1. Hi, our group is Melissa Bowman, Sylvia Doss, Shalane Pant, and Alejandro Bozarth, and we are covering autism spectrum disorder. What is autism spectrum disorder? It is a group of developmental disorders that include a wide spectrum of symptoms and levels of disability. People diagnosed with ASD generally have limited social and language skills and engage in repetitive behaviors. Symptoms of ASD vary from person to person and can range from mild to severe. Now, Sylvia will talk to you about why ASD is an important topic.
I'm going to talk about the importance of this topic. As Berger said, children with disorder often have the unusual brain pattern, which means that understanding the function of their brains might help them thrive among people with more typical neurological development. Accordingly, it's important to invest in the training of parents, caregivers, family, friends, counselors, teachers of people with autism about the syndrome. This would be of great value for the improvement of their daily life, and it would facilitate the understanding of the disorder. I chose some points that are important to be understood. The first one is statistics. Just a decade ago, the disorder seemed to affect 1 out of 2,000 children. However, there is a steady increase in the number of children diagnosed with ASD, and it now appears that the ratio turned out to be 1 out of 68 children display this pattern. The second thing is are some facts. Childhood autism symptoms that were introduced by Melissa appear early in life, typically before 3 years of age. It is neurodevelopmental disorder that persists lifelong, and 70% of them are totally dependent upon support. Therefore, it is important for everyone to know about a child with special needs, parents, family, teachers, counselors, therapists, and even friends, and to work together to help each children. Communicating and remaining with people with autism help prevent increased behaviors and improve communication. The third thing is the world of the children with autism and their rights. By 3 or 5 years of age, most neurotypical children can take the perspective of another person into account and use it to anticipate what the person will do. They can read others' minds. However, those with the disorder fail to develop a theory of mind. According to certain therapists, people with ASD have a central perception and cognitive disturbance that make normal communication and interaction impossible. Because children with autism challenges are linked to lack of social communication. If not diagnosed early, they might be exposed to bullying, school problems, loneliness, low self-esteem. Also, it is important to know that people with autism have legal rights. They are different than people with other typical types of impairments, as their impairments are related to their social ability. Service providers have to ensure that people with autism are being treated as favorably as people with physical impairments, or they will be subjected to legal claims. The fourth thing is their safety and security. If a child with autism doesn't receive the support service required to increase functioning, independence, and social awareness, he has the potential to be an aggressive adult later on who doesn't appear to have physical disability, which increases the risk of conflict. Characteristic of ASD can increase the danger of an emergency situation. For example, an individual who has no fear of danger may not realize safety limits. An individual who doesn't make eye contact may be perceived as avoiding something. Issue with social interactions and communication challenges that are part of autism can create a barrier for providing care during an emergency. The second thing is providing an understanding that the home environment of an individual with ASD isn't always the safest option. Parents do the best they can do to keep children safe. For example, they might use locks on exit doors that children who wanders cannot open. However, this would be a major safety concern for first responders, so parents' education and safety are required. Children with autism require in-depth consideration because the social and behavioral challenges these children demonstrate put them at high risk for injury and abuse. Thanks.
Hey, so the relevance of autism spectrum disorder to minority populations is an important topic. Minority children are at a disadvantage when compared to their peers of the ethnic majority. First, this is because there's a cultural bias that can lead to pediatricians having a reluctance to diagnose minority children with ASD. This is because a lot of the language and social issues are attributed to cultural differences, such as not being able to speak the language, or maybe having some odd behavior. They think it's because they're not assimilating to the dominant culture. Minority children can also present more severe symptoms. So they have a bigger delays in language and communication, and it's possibly due to cultural issues. For example, in Asian culture, it's disrespectful to look someone older than you in the eye. So if their child is not doing it, they might not assume it's an issue in the first place. Minority children also do not have the same access to treatment. This is because of lower socioeconomic status. They also do not have the same access to healthcare, whether it is private or public. And there's a lot of cultural barriers that stop them from seeking treatment in the first place. There's a lot of stigma attached to autism spectrum disorder. There is a general mistrust of our healthcare system in the United States, and there's a lack of an outreach in those communities where minority children live. And it's really unfortunate because early intervention has been shown to really improve the outcome of children with ASD. In early intervention, about 70% of the children who receive intervention can gain useful speech by the end of the treatment. And that's huge. So it's important to get kids in earlier. And here is Shellen.
So this topic is addressed by the mental health field and counselors in a few different ways. Treatment cannot fully eliminate ASD, but it can lessen the effects. Diagnosis, as Ali said, was usually made at a young age. It was difficult to find information on diagnosis of adults. Perhaps this is because this disorder was not recognized until the 1940s. And that leaves a large amount of the population untreated, and after a certain age, treatment and diagnosis is just not very relevant. Psychotropic medications can be used, such as stimulants and antidepressants and anxiety medication, but there are also many forms of therapy that have been found effective. One of the forms of therapy that I found interesting for children is the environmental enrichment therapy. There was a clinical study done with children in between the ages of 3 and 6 years old for a 6-month period. These children received treatment at home by their parents or in their home environment by their parents that was created from therapists. So they worked on different activities and different different activities for 15 minutes to 30 minutes in the morning, and then again for 15 to 30 minutes at night. And after this enrichment therapy, over 20% of the children who initially had been given the classification of autism had dropped on the scale. They were still on the spectrum, but no longer fully diagnosed as autistic. Another really interesting form of therapy was the cognitive enhancement therapy for adults. In 2013, there was a study done that lasted for 18 months. This therapy focused on cognitive rehabilitation approaches, and the targets of the CET were that the cognitive abilities that underlie successful interpersonal interactions and problem solving in daily life could be applied throughout the day and not just on specific areas that were being coached. And this was found successful as well. Another popular form of therapy is behavior therapy, obviously, music and dance therapy, and speech therapy. And now Melissa's going to talk to you about our conclusion.
Thanks, Shalyn. So in conclusion, we've talked about what autism spectrum disorder is, why it's important, how it affects all populations, and some treatment options. We thank you for watching.